Okay. Hi, everyone. As Claudia said, my name is Kazi Tasnim. I'm a third-year student at Harvard studying bioengineering, and the name of my presentation today is Prioritizing High-Risk Diseases and Non-Trauma-Mediated Diseases in a Triage on Medical Sapiens platform. Just to provide a quick background, I started interning at Medical Sapiens in June when I got matched to the company through a program at Harvard. And since then, I've been working on the team and providing help in any way I can. And it's been a very exciting process. So just a brief overview. So as Claudio had mentioned, Medical Sapiens is a medical support computer, and the goal of the software is to increase medical diagnostic certainty when providing patient care. So the database essentially has a record of more than 1,000 diseases, which were configured based on 35 models of the human body. The models represent different parts of the body in detail. So essentially that brings us to the overarching goal. So Medical Sapiens has already established this medical diagnostic software, but how can that software be expanded or improved? So the new goal is to create a new software called Medical Sapiens 2.0 that will be able to triage 16 immediate high-risk diseases. So on this slide, we have the 16 high-risk non-trauma-mediated diseases that we hope the new software will be able to successfully triage. And I'll just give you a second to look at the different diseases on the slide. Okay. So how would MS 2.0 work? Basically, the idea is that the patient care provider would be looking at 5 different criteria: pain, fever, loss of consciousness, shortness of breath, and loss or alteration of some function. We'll look into these more in depth on the next few slides. And the software would essentially be able to then properly diagnose the patient, and the system would be able to triage based on the answers to the given questions in these 5 specific criteria. So why this methodology works. So essentially, the decision criteria for triage have different weights, which are obtained through the analytical hierarchy process, or AHP. And the AHP is a method for organizing and analyzing complex decisions using math and psychology. So it provides a rational framework for a needed decision by quantifying the criteria, in our case, the 5 different ones, and alternative options, and for relating those elements to the overall goal. So using this process, we would then be able to obtain a measure of similarity with one of the 16 diseases that you saw on the previous slide. And the software would be able to output a good first approximation to one of the 16 diseases, but now it would be in terms of diagnostic lethality. So now, as I mentioned before, we'll look at the 5 criteria in a little bit more detail in order to properly diagnose and triage the patients. So on this slide, there are some questions we would ask the patient when assessing pain. So for example, we could start off by asking, where's the pain located? And then on a scale of 1 to 10, how bad is the pain? And then just continuing from there. These questions and criteria would have different weights using AHP, which would then be used in conjunction with the other criteria to spit out a value or for the patient. So on this slide, these are some of the questions we would ask the patient regarding having a fever. So again, just going through the questions, you can start off by asking how the fever started, was it sudden or gradual, and then et cetera, continuing with some of these questions. And then on this slide, we have questions to ask for loss of consciousness. So if the patient has exhibited any sign of loss of consciousness, we would start off by asking these questions. If the patient is unable to answer, you could ask someone who knows what the patient has been experiencing to kind of answer some of these questions. And then following the same ideology as the last few criteria, here are some questions we would ask the patient regarding breathing. And then here we see some of the factors to consider when the patient has some loss or alteration of some function. So basically, to sum up the main points, based on the different criteria and the questions within each criteria, Medical Sapiens 2.0 would be able to properly triage patients based on the severity of their condition. Ideally, the software would be able to properly triage patients, and by properly triage, we mean prioritizing patients according to the severity of their condition. So that's the end of the presentation. I just want to acknowledge Claudio, Mario, and the rest of the Medical Sapiens team for letting me help them the past few months and for teaching me so much about this. Thank you again.
Thank you, Kazi. There is any question to Kazi?
I have a question, if I may. You know, it's very interesting. One thing that I was thinking is, in the early years of artificial intelligence, we had these expert systems, and there was the MySim system that passed diagnostics tests. But most of those systems were abandoned because updating the new knowledge was very complicated, changing the expert rules, etc. So my question is, compared to that, how easy or how do you plan to update or to add the new knowledge that is being developed in all these illnesses? That's for, I don't know, for both of you.
Yeah. Maybe I can go, Kazi, to make this answer. Well, I thank you for your question, Enrique. In fact, what you say that about expert systems, it's a very different approach from what we are doing now. In expert system, it's more about the question of if then else. Is some kind of software that you go from one point to another, but leaving all the criteria out. I mean, if you have fever, for instance, if a patient has fever, you take all the disease that present fever. But the question is that not all people respond in the same way. You may have the same disease, but without fever. And that it's a problem in expert systems, in how they were programming in the 70 and 80.
Right.
This approach is totally different. It's an additive information. I mean, all the diseases are always present. You have to be compatible, I mean close, you're going to be close, more and more close to one of the lot of diseases that can be, okay? This is a very different way to go in the diagnosis process.
Right, I understand that. Your approach is more about pattern comparison, you know, how these two different patterns, a figure, if you want to say, match, but still, as new knowledge comes, the pattern will need to be
right, and that's it. That's a start for artificial intelligence, because you can add that new knowledge and correct the, how you say, the profile. You can correct the profile in the case you have new information. It's very easy to do that. Correct, or add a new form of the same disease. You know, a disease can present different forms. So you can show a new the same disease, but with a new permutation. I don't know how to say it. You can do that.
Okay.
There's a question in the chat. Claudio,
sorry, I didn't see it.
There is a question in the chat. How about, I think Piran Virziroğlu. Maybe she can just talk.
Yes, hi.
Hi.
Actually, my mind a little bit confused. Some symptoms are affecting each other. For example, if you have severe headache, you also feel nausea. So do you think that it should be used A and P, because there is not a hierarchy between these symptoms? Thank you.
Yeah, they are linked. You mean they are linked, so they can have some feedback.
Yeah.
Yeah.
They influence each other. Yeah.
Yes.
Yeah, and that's what's made in that way also. Well, it's maybe it's a little long to explain, but sorry, Kazi, by the way, I take your place. I'm sorry.
Oh, it's all good. It's all good.
We start with, as Kazi say, we start with 35 HP models, okay? As they were different models using the topography of the human body. But at the end, we have to integrate all these different models in a large A and B model. Do you follow me? We have, think in 35 different HP models, okay, that represent the different parts of the human body. Then, when you have all these models prepared and weighted with their own scales in each terminal criteria, then you have to compose all that model in a big and large A and P model. That's why we can establish the relationship between different criteria of different models.
Okay, thank you.
It's very long work.
I'm sure. Good.
Yeah.